Hello, I'm Professor Julie Davis, Professor of Healthcare Management and Leadership Development at Brunel University of London. Welcome to this YouTube video summarising why and how to use mixed research methods. We're going to cover definitions, how you define the term mixed methods, point out key texts and a key journal, provide justifications for adopting these designs with examples, discuss challenges and tips, look at advanced mixed methods and give an example of an activity you might like to do, as well as relevant reading to follow up. Tashikori and Creswell's 2007 definition is a key definition. They talk about mixed methods research, MMR, as research where the investigator collects and analyzes data, integrates the findings, and draws inferences using both qualitative and quantitative approaches or methods in a single study. So it's not just you do one and then the other and report them separately. The whole point is of mixing them together. So it's about integration. So probably, you've watched the news reports and they've talked about floods or droughts or disasters, and you'll have human stories, the narratives, but interwoven into that are the statistics, so the hard data. So that's what we're talking about here. Westy et al. 2022 argued that the overall goal of the mixed methods research design is to provide a better and deeper understanding of your phenomenon or phenomena by developing a fuller picture that can enhance description and understanding of the phenomena. This is distinct from multi-method research, and that is when you have two methods of the same type. So you might have focus groups and one-to-one semi-structured interviews, but they're both qualitative, or you have two forms of a quantitative approach. That's multi-method, that's not mixed method. There is a Journal of Mixed Methods Research, and one of the key proponents of this approach to mixed methods is John Creswell in Michigan, as well as Vicky Plano-Clark. And we've just quoted from Tashikori, Abbas Tashikori's work as well. This is a more recent edition of a textbook, of these textbooks in various editions. So clearly some people are purists. They would say, just do quantitative, just do qualitative research, keep it simple. So why would you bother, for example, in medical education, which can be very complicated, to use both? So the central arguments is that the example we're looking at today, medical education, is a complex phenomenon. So you've got to deal with curriculum changes, teaching methods, faculty development, student attitudes, learning outcomes. And a single method, just shunting out a quantitative survey, misses the richness of people's insights and experiences. If you just tell people's experiences, it actually misses out bigger pictures of patterns across data sets and cohorts. So you might choose this example here. You have a quantitative data study looking at the numbers of students and their preferred methods of learning. But then you have qualitative data, which actually ask what Simon Sinek says is to answer the why question. So just the fact that they prefer experimentation or simulation tells you nothing about in depth what their motivations are for answering that question. So it might be useful for you to think of a recent initiative you've had in your organization and how numbers could help, but how numbers alone are not sufficient, and how exploring perceptions of experiences can actually enhance the numbers. It's not necessary that mixed methods are bad and non-mixed methods are good. What really matters, for instance, if you're doing a PhD viva, is your justification. So when you have multiple research questions of different types, like what is the effect of X, how do learners experience X, then you would adopt mixed methods. When you want to explain quantitative results, using qualitative data. So you have a surprising finding, maybe an outlier statistic, and it's like you have no statistical explanation. You need to delve deeper. It's also when things are exploratory, you might go off and qualitatively analyze something, but then you want to actually get a grip on how often or the frequency of this phenomenon, so you will quantify it. And as we've said previously, having hard numbers and having lots of data of people's opinions, and when you bring them together, you can actually strengthen your insights than just doing one alone. So here's a question: which of those situations apply to something you might realistically do in a hospital or in your workplace? If your question is simply, what's the exam pass rate? Clearly a quantitative method is enough. But if you want to know the ins and outs of how actually people approach an exam, how they feel about it, experiential insights, clearly numbers won't do it. So within mixed methods, there are essentially three main designs. The first is exploratory sequential. So you kick off with a qualitative study, and then you quantify it with a quantitative approach. The second is explanatory sequential, where you do the opposite. You start with quantitative data, and then you follow up to explain the quantitative data with qualitative insights. The third is when you do things simultaneously and you integrate, you merge the data together. So you might have a personal preference. You might like to go off and chat to people first, and then you want to make sense of it in terms of numbers. Perhaps you'll find, personally, the sequential approach is much easier than the parallel, or actually the parallel complement each other. So here are some examples. Exploratory sequential, you interview new faculty about their teaching experiences, and then you develop a questionnaire to get more facts and data that are hard numbers. Explanatory, you go and ask, you follow up, you go and ask an interview, with hard numbers. You go and ask survey data, and then you follow up with interviews to get more insights into satisfaction. Convergent, when you do things at the same time, maybe you collect data in a general survey, and you also have focus groups, and you compare the findings. So it's entirely up to you, but try and get some logic and, quotations and citations that explain why you're doing one and not the other two. It's always useful to look at practical examples. Today we're focusing on medical education. So here you have a mixed method study to look at evaluating a student-run clinic. So were the learning objectives met? And you're going to use a quantitative study and qualitative interviews. So you might just ask the students what do they think about their own learning using a Likert scale item. And then you have semi-structured interviews that actually delve into pros and cons, barriers, contextualize these perceptions. And finally, you integrate this by comparing the survey numbers with the interview themes to understand the magnitude and nuance of the insights you're getting. All of these approaches need rigorous testing, piloting, and here's a 6-step approach to suggest how you might implement mixed methods, or at least for questions to think through. So what exactly are your research questions, and why do you need both quantitative and qualitative inquiry? And then when you've decided whether it's one of these three, exploratory, explanatory, or convergent, what are your justifications for that and the resources available for you to carry out these approaches in your design? And of course, you need to collect the data. So there may be various quantitative methods you can use and various qualitative methods. So again, you need within your type to justify your choices. And then the difficult thing is integration all the way through. So you're going to put quantitative and qualitative data in the same table together, and how you're going to make meta inferences. And then finally, what new insights are you going to argue without focusing solely on one or the other by bringing that together. And how do you need, to collect your data, perhaps in a hospital setting or a medical school, so that you can combine both and you don't just focus on statistics and have poor quality qualitative data, or vice versa. The whole point of being a rigorous researcher is that you mitigate bias. So clearly, if you've got two methods going on at the same time or sequentially, you may need to do two sets of pilot studies, and you need more time and resources to make the connections between the two data sets. So it's important to integrate both from the start, not just think I'll go off into the wilderness, do some qualitative interviews, and I'll figure out the quantitative later. You need to be explicit about why and how you're going to design it, what you can do to bring the data together visually, and maybe, people have particular preferences. So you like one method over another. So perhaps you should bring someone in who prefers statistics if you're a qualitative researcher. And you may try and make both data sets equal, but you may also decide one is going to be dominant over the other. So you're going to prioritize the qualitative, and you're just going to have some complementary, supplementary quantitative. So you might think over, or having looked at some of these literature mixed method studies, what are your personal reflections and preferences? Here's a table from Green et al. 1989 that might help you build up your argument. So is it about triangulation? Different data? Is it about complementarity? Developing one set of data builds on another? Are you prompted by some kind of paradox and contradiction? Is it just expanding to broaden the depth of your inquiry? And you might like to replicate and adapt these decision trees for deciding on this particular mixed methods design. So you can take this from Creswell and Plano, Clark's work. And similarly here, there's typologies of once you have decided mixed methods, what kind of mixed methods you're going to adopt. Leach and Ogwu-Bouzier, 2007, also have a typology of mixed methods design that you might like to look at from the field of nursing. And now we can look at several examples. So this example from Avance et al. 2022 clearly states it's a mixed methods, and it combines a cohort study using a Delphi survey, and then you have interviews. So you have a questionnaire, and then you have interviews, and then the results were triangulated. Brown et al.'s 2022 study looks at 24 third-year medical students and their training on this Stoic philosophy, which was developed with psychotherapists. And this is a mixed method study because you've got a scale, so you've got a quantitative scale, and then you followed up with semi-structured interviews at certain time points, and then the results were correlated. Here's another study from 2025 in the field of health. So Creswell and Inoue looked at a Japanese empirical research study on family medicine. So they kicked off with 13 qualitative interviews, and then they followed up with a survey which is much larger actually, so not the same people, but a survey to 232 women in rural Japan. And they categorized women who had children or who didn't have children, and they had an exploratory sequential design in this case, showing the interviews, the survey, and how they administered a quantitative survey, and then integrated this together. So you need to be very explicit that you did integrate on what kind of design from those three particular methods. Here's another study from Young et al. 2021. They used a data-based convergent synthesis design using thematic synthesis. So first of all, they kicked off with quantitative data, and then they had qualitative data, including participant quotes and themes that came from a qualitative and mixed method studies. Stadnik et al. 2021 make the point that there are particular challenges with using mixed methods, and you have to consider ethical aspects of using these different approaches and communication strategies. And to complicate it even more, Creswell has talked about what is mixed methods research, and in this YouTube video from the University of Michigan, he talks about basic design. So you've got those three we've already discussed: convergent, explanatory, sequential, exploratory, sequential. But also he's got the complications of added frameworks. So you might do community participatory action research, or experiment design, or case study design, or drawing on social change theory or social science theory. So this is more than just quantitative plus qualitative. This is within that variety of different approaches. So you've got a basic design, and then you add more complicated frameworks. So if you're running a workshop on mixed methods, you might do an activity like this. Get small groups of 2 or 3 people together, ask them to come up with a particular topic that's of interest to them. For example, here, faculty attitudes to feedback, teaching in a simulation lab. Ask the group to devise some research questions that are quantitative and qualitative. Choose a design method, exploratory, explanatory, or convergent, and then consider what kinds of methods within those approaches you're going to use and what's feasible, and then each group presents to each other. So you need to think about not just the research questions, not just collecting the data, but actually reporting on it. And it's critical that you show the value of research methods that are mixed, because some people are quite skeptical. You don't just do it because it's easy. It's not just convenience, but there is a clear linkages between the different methods, and you integrate the whole process all the way through. You don't just do a whole description of the quantitative approach and then the whole description of the qualitative without referring to each other. And clearly, the richness of your context demands rich approaches. So you need to think of what you can do that's useful within this domain. Finally, here's some relevant reading, particularly related to medical education, from the examples we've looked at earlier. In summary, therefore, we need to ensure clear justification of the why and the rigor of adopting a mixed methods approach, and secondly, ensuring there are clear steps that are replicable for others to follow. Thank you very much for listening to this video on mixed methods, why and how to use them.